A teenager needs to understand mild traumatic brain injury with respect to the symptoms and the likely changes that their parent is going to experience. So teenagers have the opportunity to take on some of this information gathering and increase in knowledge themselves. There are a lot of resources on the internet and the library where they can get information about what types of changes they should expect to see. It's going to be important for teens to understand that the emotional and behavioral changes in their parent are not their fault, not a result of anything that they've done. They're a result of the brain injury itself. And that can be really hard sometimes, because when a symptom such as low frustration tolerance occurs for a person, which is very common after mild brain injury, that frustration intolerance may come about because of something that the child has done. So the child misbehaves, or the teenager misbehaves, and the parent responds with a great deal of frustration, anxiety, or anger. The teen's likely going to interpret that to be their fault. But the reality is that while they may have misbehaved, the reaction of the parent is actually due to the mild traumatic brain injury, and it's an exaggerated response from what they would have seen before.